Executive Media. Focus, innovate, succeed.
Ikop bakube babifanani.
Olikwenda bifanani birungi. Bakukube bakwize ti oli munoni. Omukolo bagukolere.
Olina kwandula.
Olina nankani bya wedding.
Olina graduation.
Ni bobo firirwa. So kwenda kukola nankani send off decent.
Wesimbye omukalulu.
Decent.
Funaba Ikop.
Abo bulwo bayito bataako.
Tubateeko tuli kujja mukulonda.
Era tibasasula.
Be.
Kale.
Sasula.
Olikwenda bya bululu.
Yes.
Bakukube mukuba ni poster.
Ate bana.
Mukuba poster.
Olikwenda bana.
Bana do kubutundu bali. Mu poster anguli mutunigira muko chali wife.
Ani. Chali wa imazira sente. Yasina n'okumuyamba oyo omusaada. Ikop.
Eri ekindi aba Ikop.
Olikwenda poster.
Kale.
Bana. Butundu bali. Billboard. Jamba na ife aba.
Business card. Mudikola.
Ncheno naba akole ne ya.
Ne debeta bolochuwa.
Bolochuwa dindi.
Bolochuwa chechimu. Ne business card.
Ate kalenda.
Muwandika ku t-shirt.
Follow us on Instagram at Ecop Photography or call +256 702 935 078. Don't forget, they do it smart. Book with us today.
And branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
The short and big shot.
Omumwa gonfukidde omumwa Zubedah. Candle night ogimanyi. Bagita candle night bw'okutte gw'obba.
Washuga teyamaliranye ku live.
Pamoja ekiri.
Bendera ddala.
Omusajja ate nga anaakuswaza ajja kwana black sugar.
Abasajja munyiga nga tebakati.
N'oyingira n'atakubuuza. Ekibonyaabonya ababooda abasinga. Financially tracé. Oli abeera n'etaano ate nagenda n'akwanamu. Ddala mutabani wange wakati w'emyaka alina okuba ng'ekyalo akikuttemu ekitundutundu.
Anayakola kimpanya n'alagako nno panda nti si wa muzannyo.
Ate kyenayagala ku ttiimu ya Mama Finn.
Sente eziwaayo.
Naye tebasaba njawulo.
The short and big show. Abantu bajaagalira ddala. We always love you.
Hey yo, what's up my people? This is the baddest Azari right here on Executive Media with RealTime with Mimi. Stay locked in. Yeah.
If you get a third and fourth degree tear, nga tulina okutunga. Kitegeeza nti the next time ogenda kuzaala, we don't want you to push. Because that tear can come back again. So now it means that we can discuss with the patients. Letugamba, Jukira, well listen, you have a third degree tear, you have a fourth degree tear. Ochayagala kuzaala. Okay, why don't you finish giving birth and then we repair? That is one of the options we can discuss. You can say, if you say, I still want one more child, say, okay, fine. But if we are to repair that defect, it means that you have understood that, bagana, of course, if it's a third degree tear, and you've repaired it, we will advise you and say that next baby, we do not like you to push, otherwise you may get again another tear of this caliber.
So bogenda kusiza.
So most likely we'll advise you to have a C-section so that that place is kept intact. Okay? But first and second degree tears, second degrees we usually repair them, and then you can still push your baby. Yeah.
So Dr. Lwaki tuvunda?
Kuvunda kitegeeza ki?
Like the stitches go routine.
Very good. So it comes
in just 1 week.
Comes from the care that you have given to the stitches. So two things. One, the stitches that we use for repairing the muscles are absorbable stitches. Okay. And we use a specific size. We don't use a big stitch. We use a small stitch. Stitch divided 20 over 30. We use a small stitch, not a big stitch, so that they can easily dissolve. Okay, and they don't stay there for long. So the stitches are absorbed. We would use stitches that are not absorbed. No, Komao and we remove the stitches and all that. But these days, things have changed. So we use absorbable stitches. So number two is the healing, the care. All right? So it's very important that the person who has done the repair has done it well. Okay? And has repaired the muscles together. If the anus is involved, has repaired the anus. Because if you don't repair that skin of the anus, the stool will enter through that area and it will cause the place to be infected, no for a fistula. And the care. There are people, after giving birth, they go and use different things. Or because of perfumes, So, and we advise that you must take care of that place. And your doctors will tell you, if you've got a tear, they will tell you, make sure that place is clean. You can use warm water and clean that place. Okay?
But they're paying doctor.
Warm water, even without salt. Okay? And you just clean them. This is what we call warm sit baths. Or mazi. But they're a bit warm, not cold. When you sit in that water, it will just help you clean that.
Subira buli omu ali bulungi kamera nkira.
Akulindemu omuntu bw'aba akola mulinde.
Wadde ogamba ki wamma? Mukulike eyo mu Easter holiday temwatuyise mwenna abalabi b'Executive Media mwenna. Even the doctor did not invite me. But 27th May is Idi.
We shall come.
Who is going to invite you, doctor?
We shall just bomb.
Tuli ku TMR hospital. Very soon ngenda kuba introducing the app ya TMR. Buli abayagala okubeera nga ddibwamu ng'ogenda ku app kuba olumu mugenda okuncontactinga nga siriiko nga sina bwe mbasindikira namba ya dokita. Kati bw'ogenda ku app obeera okusobola okufuna bulungi services za TMR zonna nga bw'ozaagala. So tuli wano e Naalia ku branch y'e Naalia. Naye dokita leero tugenda tandika ne ebibuuzo bingi byendabye wano. Luli dokita yayogera ku blood groups. So naye abantu bakozesa oluzungu dokita wano. I don't know. So dokita oli bulungi?
Ndi bulungi.
Mwalidde emmere? From Friday you're eating. Friday, Saturday, Sunday, Monday.
That was a long public holiday. It was a long public holiday.
So we'll come back from the holidays. So doctor, wano tulinawo bamuyita Asiimwe, Alex. Agambe happy new month to you all people present. I'm blood group O plus negative. Yeah?
Agambe
I'm blood group O plus. Once natekawo bakali kalaga negative. This.
I am blood group O plus negative.
And I also do donation every 6 months. I would like to know if it's too risky for me.
So it's not possible for you to have plus and negative in blood group. It's not
Maybe
possible.
he doesn't know what he has.
Yeah, but I think they just need to confirm about it positive or about it negative. Blood donation is the act of you going to a service provider or a blood bank, no more musai. before you donate blood, they check your blood
Yes.
to know if you can actually give out your blood. Abamu, the blood levels they have are low, they can't give it out. You get it? So there's a specific test that is done to see if you can qualify for donation. Then after that, you go ahead and donate. And I think they recommend at least for you to take about three months and beyond for you to donate. So if you donate now, you can't donate tomorrow. You need to give it some time. For blood takes about 3 months to form. So give it about 3 months. Then again, you can go and check. So that person who is donating is very good. And I encourage people, the viewers of executive media, please donate. We have a scarcity of blood in the country.
Yes.
And most times when it is life-saving, when we need to save the life of a mother, then it becomes very difficult to save that mother. So that person who has been donating, please continue to donate, especially overall blood group O negative. Kubanga that person gives to every blood group.
Hey.
Yes, so those who are O negative out there, please donate. Your blood is so important to saving lives. Now even other blood groups, kubanga not everyone is O negative. There are those who are A, there are those who are B, whether plus or negative. Just go and check if you qualify to donate, and then you donate. Because that will save so many lives of mothers.
So, Doctor, Betty,
including you, Zubedah. Yeah.
Me, I will go and check if
yes.
I can donate, because sometimes I might be in need of fruits, sodas.
So please, and encourage everyone, people around you to go and donate. For us who work in hospital, we see how difficult it is. Someone comes, they need an operation.
But doctor, abantu bambaga bomusaayi n'atuuka baba wo bukadi n'atuuka ng'ate naye ali mu bwetaavu nga talina wajja musaayi.
No, usually if you have a card and you've been donating, there's where the blood bank really tries, because you've been saving so many lives. They try to consider you. And I know for people who are blood donors, who are donating and you have a card, somehow it's easy for us to actually look for blood if you're a blood donor.
If you have that card.
If you've been donating blood, yeah. But it's very, very important to donate blood.
Yes. So, Betty, I'm blood group O negative, and all my children are resus negative. I'm one of the few. Chechi doctor.
So, oyo, ekitegeeza nti blood group ye eri negative. Naye n'abaana bali negative. So most likely maybe the husband is negative. You get it, eh?
Yali negative, no mommy yali negative.
So that's how most likely one of the possibilities the husband could be negative. So that person is really free of any risk of getting miscarriages because of blood group issues. You can reach out to a government if the mother is negative, then the baby who she's carrying is positive. There is during the time of birth, there is a mixture of blood that happens. That makes the mother to form defense against the next pregnancy. So if the baby is negative, it means the next pregnancy is still going to be safe like that. So that is indeed, she's one of the few people.
Hey Zubedah, can you please ask the doctor about the blood groups and what they shouldn't be eating? That is a very big topic.
I know there are so many people who have diverged and started saying things like there's a blood group that is stronger than the other.
Yes.
And there's a blood group that puts you at risk of other diseases than the other.
Yes, there are some things you shouldn't eat with your blood group.
For us in the medicine world, we do not have such facts. Until this person is going to only eat these foods. If they eat these other foods, are more at risk and all that. We think all blood groups are okay. You get it? The only challenge comes in if it comes to childbirth. That's when you have to know you read your blood group. And we haven't reached a point. I'm yet to see some of those researches that show that, and really evidence and conclusive research that why umuntu in a blood group A tasobola kufuna pressure or bichi, because we know some of these diseases are genetic. They're not entirely linked to the blood group. There could be a genetic risk for it.
And people are there teaching about that.
And yeah, of course, I know people know that truly desperate,
Yes.
So any rumor we hear, then we start going with that. But some of those things are just rumors, they're not facts.
They're not facts.
Yeah.
Okay.
So that person really, I do not have, I don't want to scare them. I would encourage them to really just be healthy, eat healthy.
Yes.
Yeah, have a balanced diet.
Eating healthy is
Exercise.
not chips.
It's not chips and chicken and pizza and all those things.
Pizza, chips.
Yeah, so just make sure you have a balanced diet, you have fruits, you have greens, and then you're hydrating enough.
Yes.
And then also have regular checkups, because that's when we can pick out some of these things early, and then we're able to prevent them.
Okay. So the last two seem to be the same, but different people. Namale Hope is saying, "Hi, Mommy, thanks for the show. Can you ask the doctor, can I get married to a man who's blood group O? I'm also blood group O."
Yes. You can get married to anyone with any blood group.
Oh.
You get it? Even those who are Ngoli negative and the husband is positive, even those, there is no restriction for marriage. All we are saying is, Ngoli negative and your husband is positive, there is a special medicine you're supposed to get when you know
Anti-D.
the anti-D.
Doctor, mbere yo kati nati
If we
osomesa
continue with
abantu.
this show for 5 years,
But even the viewers, they're also becoming, they are very attentive.
yeah. So there's no restriction for marriage. Unlike other diseases, for example, the sickle cells, where we have a bit of, because we know if you're a carrier and then your partner is a carrier, there is a high chance of getting sickle cell disease if you're conceiving naturally. Those ones, we may tell them, you may have to avoid someone who is a carrier. But if it's blood group or negative, or they are A plus or whatever, what we are saying is find out your blood group. Then in hospital, if you are negative, your husband is positive, there is a special injection, anti-D, you're supposed to get at maybe 7 months or within 3 days of giving birth, to protect you from getting miscarriages in the next pregnancy.
Okay. So, but njagadde nyo Dr. Soka abaddemu ebibuuzo byammwe ku blood group C. Kali aka tolya kino, tolya kiri, olwo olina group, blood group ki Dr. agambye tebatakirinaako hadithi. Okategeddako Dr. Takirinaako kumanya. So olunaku olwaleero njagala Dr. atuyambeko twogere ku tearing, like ewuzi ze batutunga, okuyulika kwe tuyulika nga tuzaala. Obulumi abamu bavunda n'ewuzi ezo nga balina okuddamu. Waliwo be batunga obubi nga bamaze okuzaala. Waliwo abasitula mangu ebintu n'agamba, waliwo abeegatta amangu nga wuzi tezinnaba. So tubeera waliwo abafuna fistula around the way nga ne wuzi tezinnaba. So I don't know biki ebikireeta. So I have a lot of questions to ask you, Doctor, about that issue. So njagala kutandika na kubuuza Doctor, lwaki mututunga ne mutatusannyalaza?
Okay, so okweyulika. Okuyulika.
Yes.
Tearing during birth is very common, right? And it is more common among the first-time mothers. Okay, for some of the reasons I'll explain. So they say over 70 to 80% of first-time mothers are likely to experience tears. That means tetusobola kutunga nga toina tear. What do you say? We only kutunga if there is a tear. Okay? And not all tears sometimes require kutunga or repairing. Okay?
Okay.
So first we will start by saying tears are very common during the process or during the time of childbirth. Why? One, because when the head of the baby is coming out of the vagina, that baby's head is most times bigger than the vaginal opening. Okay?
It's not about the weight of the baby.
It is not about the weight of the baby. It's mostly the size of the head. Of course, the weight is a reflection of, if a baby has 4 kilograms, most likely has a bigger head. It's very rare for you to have a 4-kilogram baby with a small head. You get it? So there's a factor of weight, but mostly it's the pressure, the push of the baby through the vagina. Kati vagina ina muscles. There are muscle structures that support the vagina. Okay? So there's an opening of the vagina, and then there are muscles around the vagina, and some of those muscles even go around the anus. Okay? So we have a vagina, Let me see. I want to show you some of
The
these images.
pictures.
So, we have a, okay, so you have a,
leero dokita mukutte asooka atunnyonnyola ebintu bino eby'okuyulika tubeere nga byonna ebintu tubimanyi tugenda mu kuzaala nga tuli twetegese bwe baba bakutunze kiki olina okukola kiki otalina kukola dokita bwagamba tugenda kukutunga n'ogaana olwokuba bakugambye singa oyulika gaana okukutunga ojja tutuula mu munnyu owone dokita byonna tugenda bimubuuza.
So we have if you look at this is the structure like this. This could be the structure of so there's a vaginal opening, okay, and
that's where the head passes.
Yeah, so usually the head passes in the vagina.
Yes.
Okay, but this head is going to stretch these muscles. These are muscles, they call them perineal muscles. It's going to overstretch them and sometimes even stretches the muscles around the anal area.
Yes.
Take it. Because that head must come out of the vagina. Now, if for first-time mothers, depending on other factors, could be the size of the baby, could be on how you're pushing. There are some mothers, we tell them,
don't push. Auntie doctor, there is a force telling me to push, and the doctor is telling me don't push. What would Doctor Logic start again?
Yes, so it's tough, but you see, it's very important that if you're in labor, you're listening, okay? And we only tell you to push when there is a contraction. If there is no contraction, why are you pushing? But the people who are going to push, whether there's a contraction, whether there's no contraction, you get it. So it's very important to listen. So the birthing position, okay? The position that you're having to give birth. They usually say commonly, the people who try to give birth while lying on the sides, while on the knees and the hands, you get it, while squatting, tend to have less stairs than those who lie on the back. You get it?
Doctor, you can push while
on the sides.
On the sides?
Yeah.
I've never seen it. You always tell us to put the legs apart and push.
Yeah, so the one of putting the legs on the back, of course it seems easy, but it sometimes presents with tears. But it depends, not for everyone. So the birthing position, the size of the baby, the way you push, okay? And also the support that the team is going to give your doctor or your midwife, okay? Sometimes we have to support the muscles. There's what we call perineal support. There's a way we support so that it doesn't tear, all right? And then sometimes we use warm packs. Could be a warm cloth. When you use a warm cloth, it helps to relax those muscles and allows them to stretch.
Who uses it? The doctors,
nurse or
the
nurses, or the midwife or the doctor. Okay, so all those factors help to minimize the tears. Sometimes even we tell the mothers, can you start doing exercises before you've come to give birth? They are what we call perineal massaging exercises. For example, the way you go for massage. Okay, this time you're massaging the muscles, the vagina and the muscles around. When you massage those muscles, you relax them. So that even if they are stretched, they cannot easily get torn.
We massage them with what? Cooking oil?
Not cooking oil. They usually say you can use almond oil, you can use...
chigaji.
Not chigaji. Even just the jelly. There's this jelly, they massage, the KY jelly, and some of these massaging oils. Just massaging that place helps to relax those. And you can start the massages from 34 to 35 weeks. Okay, you start massaging and you prepare yourself. Okay? So when you do those things, the chance of you getting a tear is minimal, not impossible. Okay?
But minimal.
Minimal. So what have I said? That these are very common among first-time mothers. And I will notice that someone who has got a tear in the first baby, they're not likely to get a tear in the second baby because already the muscles have been stretched. You get it? They're not as stiff like they were in the first baby. So
they didn't get back.
I'll come to that. I'll come to that. Yeah. So there are various factors why you get a tear. But number two is that there are two types of tears. One tear that happens on its own. You have not listened. I've told you, so tosindika, but you're pushing. Then as the baby comes out, it just tears the place. Then sometimes the basawo can see Nedda, the baby's head is bigger than the place. Can we help to create a small tear, what we call an episiotomy, and that episiotomy helps that baby to come out. Check it.
Doctor,
So
you tear.
we give a cut. The reason why we give a cut is because we don't want you to get an ugly tear.
Oh.
Check it. If that baby comes out without control, you can get a very bad tear compared to when the doctor has cut you. Okay? And the tear can happen on any area, can even happen up near where the urine passes, can happen down, it can go up to the anus, you get it. But if the doctor cuts you or the midwife puts a cut, an episiotomy, usually the cut is on the sides. So that
It
tear
doesn't pain.
we numb you. We give you medicine as well. Then after, as you're pushing, we try to cut and create some space so that the head comes out. You get? So when we do that, that tear that you've got from an episiotomy is controlled compared to the other one that you got without the control of the musao. So two types of tears. There's that comes on its own, then there's that comes when the musao has put a cut, right? And we're saying that the one that the musao puts a cut is better. It's easier to repair, and it doesn't involve other structures compared to the one that gets torn on its own. Finally, there are 4 degrees of tears. Okay? What do I mean? You can give birth, and it's just only the skin of the vagina that gets torn.
Only the skin.
Only the skin. For example, just if this is a vagina, you may find that there's just a small cut on the vagina, like you can see from this image. You can see the 1st degree. It's just within the vaginal area. Okay? So that one is called a 1st degree tear. 1st degree means it's a very small tear, area on the surface. Okay? So like how you get a small cut here on the surface. So that is usually a 1st degree tear when you're giving birth. Then we have a 2nd degree tear. That now involves the muscles. Look at the muscles I showed you. Okay? So there are these muscles here. These are muscles of the perineum. These are muscles. Okay? There are even muscles that control the sphincter of the anus. Okay? You are able to hold gas. You are able to hold stool. If you felt like going to the toilet, now you're not in the right place, you can control that. Those are muscles that do that. Okay? So the 1st degree is just on the surface. 2nd degree can involve some of the muscles. Now they don't involve the muscles of the anus. The 3rd degree tears involves the muscles that control. You can see the 2nd degree, it has gone slightly deep. 3rd degree has gone almost deeper. It has even torn some of the muscles that control the anal opening. So Mundo, you will find that she's there. Now that person cannot control gas. If the gas comes, just buisi. If that person wants to go to the toilet, they can't control it. They just have to run to the toilet. Otherwise, if they take long, the stool comes out. So that is involving the muscles of the anal area. Your 3rd degree. Kati 4th degree, that tear okuva wano on the vagina, it has gone all the way up to the anal skin. So, 1st degree tear, sometimes we don't even repair. Or in and not no longer bleeding. Okay? And you let the person be, because it heals nicely. Okay? We only put a stitch that waloka bleeding. Okay? You've checked na walo some oozing or bleeding. Let me put a few stitches. Okay? 2nd degree tear, the muscles are involved, so you need to bring back those muscles. Zikomao. Because if a muscle gets torn, it gets pulled away. So the role of your musao, the midwife, the doctor, is to bring them back so that that muscle comes together and the healing happens. Okay? If you don't repair a 2nd degree tear, that person is going to feel like the opening has widened. So sometimes you may find the husband is saying, Mkwano, from the time you gave birth, or you find that patient will tell you, I no longer enjoy sex. Okay?
It affects sex.
Yes, it can affect sexual, especially sexual functioning. The partner feels like, they're not tight as they used to be. You get it? Or the woman herself is like, I no longer feel the intercourse. You get it? So it's very important that even the doctors themselves are able to assess that. Sometimes when you're repairing, you're supposed to repair carefully. Again, there are doctors who over-repair and make the place so tight. You over-tighten the muscles that when the person heals, they don't enjoy sex. It's painful.
They have to come back.
They have to come back and then they have to sort of relax because the sex is painful. Okay? You get it? So the repair has to be done well. But both doctors and midwives have been trained to do the repairs of the second-degree tear. The one that is difficult is the third and fourth degree. Because at the third, it has involved the muscles that are not opening. So it requires really a specialist to be able to.
Not a normal doctor.
Most times we require a gynae to do that. Even normal doctors have been trained, but the best people would be the gynaes, yes. Because that training involves doing that, you get it? So that third degree and fourth degree cannot, it is difficult to repair mu labor ward. So most times, yes, because omuntu awera nga tali relaxed, and it may take longer. So even if we give you a dagara kasanyalazawo, after a short time it has worn off. Then you start feeling the pain.
Yes.
Then you're fighting and all that. So this third degree and the fourth degree tears, they're best repaired in theater.
After birth, they take you to the theater again.
Now to repair these tears. Because if you don't repair them well, the person has consequences. So tugambye nti waliwo degrees nya. Era buli omu azadde. Your musawo is going to tell you oyina first degree or in a second degree. What kind of katikano? This one is hard. This one is third degree and a fourth degree. So you need to understand if it is third degree, it means that the muscles that don't hold the muscles that hold the anal area have been affected. And if you don't repair it well, you are the one who's going to be affected. Okay. Fourth degree, if it has gone through up to the anal skin, what we call the anal, the rectal mucosa. If you don't repair that, omuntu oyo agenda funa fistula. Fistula kitegeeza nti waliwo communication from the anus to the vagina. So that person can have pupu or stool ngayita mu vagina. Kubanga waliwo ka opening that was not repaired. That is called a recto-vaginal fistula. Kitegeeza nti fistula evudde mu rectum paka ku vagina. Recto-vaginal fistula. So the tears for us, not all tears have to be repaired. Okay? Not all tears have to be repaired. But it's very important that the person who is seeing you is able to identify the degree of the tear. Ntikateno, the first, the second, the third, the fourth. So that they can do the right repair.
Okay. So, Dr. Wembanga wenazalira tebankolako bulungi. Oba kati waliwo abakyala kuzaala kumusanze waka ne bamuyuza bo bennyini waliwo be baatunga ne babatunga obubi. Can I come back now?
Yes.
For a good repair?
Yes. We actually do what we call perineal repairs. Perineal repairs means that we try to repair back those muscles properly. Now, those who were not stitched well and they don't feel, like I told you, maybe their sexual dysfunction is not okay, or they can't control the stool, they can't control the gas and all that. Yes, you can definitely come back, go to hospital, and you explain to them. So tell them, I gave birth such and such a time, and then this has happened. Then the Musawa is going to check you and examine. Then he will tell you, no, wafuna second degree tear, or wafuna third degree tear, which take it. And then they will plan for repair. Okay? Okay. Yeah. So it's very possible to do the repair.
Okay.
Yes. But when you have, sometimes we discuss with the patients, if really the symptoms are so bad, we do the repair. But sometimes also, for example, if you get a third and fourth degree tear, nga tulina okutuunga. Kitegeeza nti the next time ogenda kuzaala, we don't want you to push. Because that tear can come back again. So now it means that we can discuss with the patients. Letugamba, Yukira, well, listen, you have a third degree tear, you have a fourth degree tear. Ochayagala kuzaala. Okay. why don't you finish giving birth and then we repair? That is one of the options we can discuss. You can say, if you say, I still want one more child, say, okay, fine. But if we are to repair that defect, it means that you have understood that, of course, if it's a 3rd-degree tear and you've repaired it, we will advise you and say that next baby, we do not like you to push, otherwise you may get again another tear of this caliber.
So
most likely we'll advise you to have a C-section so that that place is kept intact. Okay? But 1st and 2nd-degree tears, second degrees we usually repair them, and then you can still push your baby. Yeah.
So Dr. Rachi Tuvunda, like the stitches, good routine.
Very good. So it comes
in just 1 week.
Comes from the care that you have given to the stitches. So 2 things. One, the stitches that we use for repairing the muscles are absorbable stitches. Okay? And we use a specific size. We don't use a big stitch. We use a small stitch. Stitch divider 20 over 30. We use a small stitch, not a big stitch, so that they can easily dissolve. Okay, and they don't stay there for long. So the stitches are absorbed. We would use stitches that are not absorbed. Komao and we remove the stitches and all that. But these days things have changed, so we use absorbable stitches. So number 2 is the healing, the care. All right. So it's very important that the person who has done the repair has done it well. Okay, and has repaired the muscles together. If the anus is involved, has repaired the anus, because if you don't repair that skin of the anus, the stool will enter through that area and it will cause the place to be infected, no for fistula. And the care. There are people after giving birth, they go and use different things. Or perfumes, so. And we advise that you must take care of that place. And your doctors will tell you, if you've got a tear, they will tell you make sure that place is clean. You can use warm water and clean that place. Okay?
But they're paying doctor.
Warm water, even without salt. Okay? And you just clean them. This is what we call warm sit baths. Or but they're a bit warm, not cold. When you sit in that water, it will just help you clean that place. Put in salt if the place is getting a bit infected and something. Because salt also helps to eat away the dead tissue. You get it. But taking care of that place and making sure you come back for review. All right?
They check them.
Yeah, so when you come back after giving birth, after let's say 1 week, to carry that, we say, okay, is the place healing well? And then also we give you antibiotics. So the people, they write for you antibiotics.
We don't buy them.
And then you don't buy them. Okay? And then also we want you to rest that place. You cannot have, you've had stitches repaired, and this goes to the men. Your wife has had stitches repaired, but for you the next...
you want sex.
You want sex. Because when you do that, it means that you're affecting the healing process. Okay? And we encourage people who have given birth to take about 4 to 6 weeks. But until the woman feels she is okay. So you may find someone has taken 4 weeks. She's not feeling fine.
Yes.
So the woman must listen to her body. There are those who have healed faster. In 4 weeks, now they feel fine, they feel better. Okay, those ones can resume. Okay, but give it about 4 to 6 weeks. But if the woman is not feeling ready, she's still feeling sore, okay, do not insist to proceed with the sexual intercourse. Kuwanga, you're going to affect the healing. Those muscles are going to get swollen again. When they get swollen, zifuka infected, and then that even takes longer for the person to heal.
Okay, so doctor, frequent walking endetera ezowuza okuwona amangu nezikutuka.
Walking is very okay. Walking is very okay. In fact, all we want to do is to advise you on the diet. So we don't want you to have food that makes you constipated.
Yes, okay? Doctor. But it happens even if you don't.
Yeah, it can.
It happens the following day, you get the stitches.
Because you're fearing to go to the toilet. So the constipation can come from 2 things. One, what you're eating. You're not hydrating. You're not having diet which has what we call high fiber diet. So greens and fruits and all that. And then it can also come because you're fearing to go to the toilet.
Yes, the fear is...
The fear is natural.
Yes.
But you know that the more you go to the toilet, the more softer the stool is going to be. When you take a day, or 2 days in a toilet, what is going to happen is that whatever is in the rectum, the water is going to be taken away from it. So that stool is going to become harder. So if you take more than 1 day, 2 days, 3 days.
That pain of the following day in the toilet.
Now, naturally, you make sure ofunye dagala.
Even if you get the medicine. Do you give the medicine for that pain?
We give medicine for pain. We give you pain medications. Sometimes we give you Rectos.
Rectos, yeah, Rectos do work, but doctor.
So if you take longer,
you get constipation.
The stool is going to get harder and harder. By the time you want to push, it's really hard and difficult. Okay, but walking should be encouraged because when the more active you are, the quicker you heal. When you are there lying in bed, you're not. You're going to take long to heal.
So, doctor, there are some women who carry heavy things after birth.
Yeah.
Ngate bayina stitches, neziddamu neziyulika.
Yes. So so it depends also on how the stitches have been done. If the stitches were not done properly, okay, it's easy for the stitches when they open. It means now we cannot do anything. The time we have to repair you are within the first few hours of giving birth.
Wow.
Okay? Within the first 6 to about 24 hours. After that, if you have not been repaired properly, you have to wait for 6 weeks.
To come back?
To be repaired. Why? Because the longer you take from giving birth, the muscles, we call them what, Muruganda? Producer, what did you say?
Muscles, emiwura.
Emiwura. The longer you, from the time of giving birth, the emiwura, the muscles, are going to become sore and swollen. So it makes repairing them harder. That's why the person who does the repair should do a good job from the very beginning. Because when it takes more than a day, when you come and check, the muscles are swollen, we are likely to tell you, Ojiro Linda, until after 6 weeks, then we shall reassess, then maybe we can plan to repair them.
But that's in the theater now?
Yeah, theater. That will be in theater.
But doctor, again, there are some hospitals, abatatusanyalaza.
So that
giving
is
us stitches.
That is really wrong.
Nebagamba when bwoba ofunye normal delivery, tewetaaga kusanyalaza osobola okufa.
That is wrong. Okay? Because this is a human being. This person is not a cow. This is a human being. So as doctors, as health workers, we need to listen. Yeah? When someone says there is pain, give that medicine to the patient. All right? I know sometimes we say that the skin, I want to skin that even if you kusanyalaza that the pain is still there, but at least give the medicine. Okay, there's something the medicine will do. It will reduce the pain from that person. And then you're able to do a good job. Okay, if the person is in pain, even you, the doctor, you can't repair properly. They are going to be kicking you, they're going to be lifting their legs and all that. All right? And there are so many ways of that. I usually explain to the patients that if it's a simple tear, I will ask you to cooperate. I give you medicine, okay? But if according to you, you're still in pain, you get it? We cannot do it from there. Then we may have to shift you to theater. Kubanga mu theater, we can give you medicine osobola kwewaka.
Ne muntu nga doctor kyekiba kiddako. Muzikize ku bantu dokita wiwuze yeeruma.
Ati kati tetusobola okuzikisa buli omu. Okay? But if someone is in pain and they're given medicine, achawulira pain, achawulumizibwa, and the defect, whatever has to be repaired is a bit much, then give someone medicine, they sleep. Or give someone medicine that can, there's what we call a saddle block or half anesthesia. So ulafuna wakaiso mu mugongo, ne bakusanyalaza wansi, ne bakutunga bulungi. It will come at a cost if you're in a private facility. But it's better than you going through a traumatic experience and then you never want to give birth again. Okay, so but the doctors should be able to explain to you and you should be able to understand. Sometimes I know, of course, maybe in government, they have very many patients to attend to, you get it? And maybe for you, you are taking long, there's another person who's giving birth. So sometimes maybe that's where, but even them, they also have the medicines. and they should be able to give you that medicine. Yeah.
So doctor oludda tulina omubuuza ku mpisa eyo gye mukuba be mugenda olongoosa empisa abantu balwala emigongo gye muba kuba wano ku mugongo.
Okay.
Abagenda mu theatre. Yes, abakazi abasinga bakaaba emigongo obulamu bwabwe bwonna ng'agamba empiso gye bankuba wano yandeetera obuzibu. They have back pains and stroke back pains.
The injection we give you on the back, we are targeting a specific space. Kumugongo. The back has got what we call spine.
Yes.
Okay? Between the spine bones, waloka space. If there is this bone, there's another bone which is supposed to be connected to this one. So there are bones that are connected to each other. But between those bones, waliwo space that we target. Akaiso empiso. It depends on how the patient is positioning. It varies for person per person. One person you may assess and you get into that space in the very first attempt. Omulala, you may find that the back is not positioned normally. So the person has to keep trying. They have to keep trying until they succeed. We give you some medicine okusanyalazawo. So the first thing that should be done is to give you medicine to numb that place. Then that musirisa will try until afunya your space nakolachi nakuddagala.
So eryo terisayita musuwa.
Nedda. Because edda some years back we used to give general anesthesia.
Yes.
Mwebasa yenna. The problem is that medicine can also cross to the baby. So if you delay to remove that baby, ogenda kuzala mwana ngakolache ngatakaaba bulungi. So, and if the baby doesn't cry properly, the lungs don't open. The lungs don't open, that baby is going to struggle breathing again. Even the brain can be affected. So that's why we can still give that, but we no longer do that. We only give you the general anesthesia if the one of Mugongo has failed. Why would we prefer the Mugongo, the half anesthesia? Because one, you are able to interact with us. So if you feel something, Doctor Eladu, and then we're able to intervene. Number two, you're able to see your baby. You remember those days they would say, I was expecting a boy, now it is a girl, and all that. They have not changed anything. So these days you're able to see the baby. As soon as the baby has come out, they show you the baby, they clean, even start breastfeeding the baby with it. You get it, eh? So, and number three, that medicine does not go to the baby. So the baby is able to cry well and adjust to life. So that's why we do half. So we cannot, the half means that there's a special particular area on the back that we must give that medicine, so that half of this part is able to be numbed, which is different. If you put it here, it cannot do the same role.
Okay. So why do they get those consistent pains? Is it a one?
So
back pains.
It depends. I think it really depends. Not everyone who gets the spinal injection gets back pains, but it depends on how the procedure was done. Okay. If there was a difficulty, sometimes you may find your back was just difficult. You're not positioned well, or your bones are too close to each other, or for some reason the person doing the anesthesia found it difficult to pierce you and get it at the first attempt. All right. Yeah. So, but most times those are things we discuss with the patient. Even the musirisa has to discuss with you and tell you that this can happen. You get it? And over time, really, we expect those, because it's not like osigalango in a permanent. How can I say that space will open? No, that space is going to close. You get it? We don't expect you to have a permanent back problem from that injection. So if that person is still feeling that pain, let the doctors check and see what is happening. You may be blaming the spinal. You get it? And it's not the injection, it could be something else. But because for you remember the injection, you blame it on the injection. There's something else that is causing the pain.
Okay. So abakyala ali eyo nga dokita ng'omukyala ali eyo bamutunga wuzi ne ziddamu ne zita n'afuna eddagala ne baddamu ne bamutunga naye nga bwe yeerabako waati alaba bamutunga bubi mwana aba yamuyuza oba dokita aba yamutunga obubi nga bwe yeeraba bw'ati awuli ayagala kuddamu bamutunge ofaanana bubi.
The problem with kutunga, there are usually two things. One is that if that place is bleeding, you want to stop the bleeding so that you save the life.
So when you stitch, you stop the bleeding?
Yes.
Wow.
Much as you're bringing the muscles together, you're also stopping the bleeding. You get it, eh? So it depends on what is prevailing. But like I've said before, there are standards, there are ways that the repair should be done. Okay? And there are different specialties. Nakugambe, 3rd and 4th degree tear should be done by a specialist. 1st and 2nd, midwife can do that, or a general doctor can do that. You get it? And those ones can be done in ward. Sometimes the 2nd degree tear may be difficult to repair in the ward, and that we have to take you to the theater and repair. But the most important thing is that the person who does that repair should do it well. Okay?
We're very much zigzag.
And the other thing is that just what I zigzag once, because that place heals quickly. Number 2, the stitches are, it's not like ofunye gundi mumpale kati bakutunze katusigala nga
oh, they dissolve. They
absorb. So it's very rare for you to kebera and then you're like nga waloka zigizaga
kanzireyo bantunga bubi. Because we need a design when you're stitching. Give us a good design.
The principles of repairing is to bring back the muscles together.
Not designs.
There's no design. So if these are the muscles and then they got tone, so the person who is repairing you is going to make sure they make them as normal as before. Okay? So what are they going to do? They're going to get this area and put a stitch here and bring them closer to each other. The place has come back to how it was. Yeah.
Okay. So Dr. tweyanziza nnyo tweyanze olunaku olwaleero kakati wemba omukyala ali okwo ng'alaba executive media nga tebaamutunga asobola okujja mu ddwaliro wano n'afuna consultation.
Then we assess.
Naye kati eyiyo ebeera different case eya gwe bataatungirawo ayinza okugenda mu theatre.
Depends from the assessment. But also waliwo camps, there are usually camps that are being advertised by whether Mulago and all that, for people who have tears and fistulas. The other fistula was from the rectum vagina. Now we have fistula, that also comes from the kawago, the bladder to the vagina.
Oh, banabata musulu.
Okay.
Yes,
so
and
usually,
those ones are many.
That usually happens when the baby has pressed, the baby has taken long without getting delivered. So pressure from the baby's head pressed on the bladder to the point there's a hole that formed. The urine just flows. And also that one has to be repaired. So there are usually camps that are organized, and people should look out for these camps. There are usually camps organized. Mulago organizes some of these camps. Barora organizes them.
Even Bombo.
Okay, even Bombo. And so when you see these camps, they usually talk about fistula, but also even people who have tears that have not been repaired. You can actually go in, they will assess you, then if you need surgery, they will book you for the surgery. But if you're there and then you're just not feeling fine, you're feeling extremely tight after the delivery, or you're feeling extremely loose after the delivery, or you're feeling you can't control the stool, controlling gas and all that, genda kudwaliro. Let the doctors, let the gyne assess you, and the gyne will tell, this tear, ABCD needs to be done, and then they will definitely.
So, doctor, it's only the gyno to do that. I cannot get any medicines to bring back those muscles.
So it depends. For example, if it's a 1st degree tear, you can use whatever. I know, of course, we want to use the herbals.
Yes, the herbals. We sit in the herbals. We use them and they bring them back.
But for 2nd degree, 3rd degree tears, no amount of herbals
you can use.
No amount of herbals you will use will help bring them back. But for the 1st degree tears, okay, and maybe some 2nd degree tears, there are exercises we advise you. There's what we call the Kegel exercises.
Kegel.
Kegel, it's like when you're going to pass urine and then you hold the urine in the middle. Okay, trying to, so you find that you're strengthening the muscles, you're training the muscles. Some of those muscles help, some of those exercises help the muscles to come together. All right? But you may find that you've done Kegel, Naenga, there's no change. Then you just, maybe or secondary or third degree, then you need to come to hospital, then the muscle checks you.
Okay, katwerekereza Dr. agenda akole. Yenna ali ku executive media nsubiro ina kyofunyemu, ayina teya agenda mu ddwaliro. Ng'owulira tewewulira bulungi, genda mu ddwaliro buze Dr. yenna oba gayino yenna akuli okumpi omunnyonnyole. Babeere ng'ate bakukolako oddemu feeling normally.
Yeah, but all these things you should be discussed during your antenatal. Again, goes back to antenatal. The antenatal should prepare you.
Antenatal.
Exactly. So people don't do antenatal, so they're not prepared exactly
yes, we're not prepared
the time of childbirth. When you come to give birth, they're telling you to syndicate for your pushing. Get it?
But doctor, there is that force. The doctor is telling you don't push, but there is a force that is telling you to push. You're feeling the pains.
We teach you what we call breathing movements. That's when we tell you, take a deep breath and you blow a balloon. You get it? Oh, you're blowing out. So when you do that, it helps you not to push. Because at that point, you feel the pain.
You feel you want to
push. But you have to channel that pain to in a different way by you not pushing, by you breathing in and out, taking deep breaths and blowing them out. You get it? When you do that, it helps you not to push. The force is going to be there. Even during the contraction, even if you not reach the time for pushing. But you have to listen. That's why it's very important to be prepared before giving birth.
But when the contractions start, you need to be near a doctor.
You need to be either a doctor or a midwife, because they will tell you what to do. They will tell you, do this, breathe like this, take a deep breath, blow out, or do this. And when you do those things, it helps you really control and you're not pushing.
Because there is a time you say the centimeters are done. Now we are going for labor. Now when we reach the labor, you start, don't push.
Because the head is still up.
Oh, you're waiting for the head to
go down. So that, because we want you to push and the impact of the pushing should be seen. Tetwagala osindike nga tewali impact of the pushing. So for you thinking of pushing, the doctor or the midwife is thinking of, is this baby moving? Because when you push, the pushing should help the baby to come out. But if you're pushing and the baby is not coming out, it means that there's something, the baby hasn't yet calmed down properly. So
yet the centimeters are done.
Yes. So we need to give you some time. Either we can ask you soko tula mubaketi, walk around or stand, so that the baby comes down properly. So that when we ask you to push, those are people who push only twice, and the baby are following me. But
those who listen.
Those who listen. But for you, they're telling you don't push, you're pushing.
Yes.
You'll push for maybe 30 minutes, an hour, and the baby hasn't come out because it is not yet the time.
Oh, that's why we spend a lot of time in labor.
So, and usually that second stage of pushing, you should not last more than 2 hours.
In the labor?
Yes, at that point. Because longer than that, the baby starts getting tired. That's why we want you to push when it is necessary. So, doctor, you say when that water is out, obviously the baby must also be out. That's what is in our heads. So me, when I see that water, I will start pushing. You're not supposed. The water can come out even in 4 centimeters. Do you know that? Yes. So why are you pushing at 4 centimeters? Doctor, we are just green about what we were told by those women, those old women in the villages. No. Obviously, they tell us, sindika omwana abazzi. So that is wrong. You only push when the midwife, the doctor has asked you to push. Because you're going to sindika only for 5 centimeters. Sometimes we think you want to take us to the theaters so that you get money. Because we have seen the water. Do you know theater is harder than the normal delivery? Yes. Why? Because there are more complications that can happen in theater. No doctor in their right sense wants to take you to theater. Okay. We are so green about labor. Yeah, but it's important that between channels like this, yes, my YouTube channel, also. How is the YouTube channel? It's growing. It is in Dr. Eladu. Dr. Eladu, yes, Emmanuel. Emmanuel. Please subscribe. Yes. Because there is a lot of information for pregnant mothers on that channel. Yes. Zubedah, please tell me. I've been watching you. So please, Bambi, Mbasaba, Dr. Eladu ina channel ye. Whatever nga tochifunye ko executive media agenda
Dr. Eladu, Emmanuel, or subscribing, or liking, onyiga akadeka notification. When you subscribe and you don't have the notification bell, when he uploads, you won't be aware that he has uploaded. So when you subscribe again, watch at least for 10 minutes.
Yeah.
Because if you don't watch, after some time, your subscription will be taken. So it's about
watching.
Watching.
And the short videos are usually about 15 minutes and something
on
like
TikTok.
That, eh? Yeah. Even YouTube. YouTube usually we
have
don't
shorts,
make them.
yes.
Yeah. We have the shorts. Then maybe if it's a conversation with the spouse, we go about 20-30 minutes. But the reason people get problems because they don't have knowledge.
We don't have knowledge.
And now we are trying to bridge that gap. We want to really teach as many people as possible.
Yes.
So that even if the antenatal is not good, you go there and you have some knowledge. Okay, when they tell you don't push, you may not. That person may not explain to you why you shouldn't push, but already you understand, maybe because of the information that you watched.
Okay. So mugende mu subscribing ku channel ya Doctor. Bwomalo subscribing alabake dakiika nga 10 because bwotaziraba subscription eba mala ne bagikola ki ne bagitwala 10 oba 15. Kubanga ate ekirala onyiga akadde akaliko notification bell. Doctor bwa uploadinga ogenda kubanga buli wateeka bakweta ka notification waggulu wano that Dr. Eladu has uploaded something new. Awo oba osobola okulaba kubanga wano Doctor atumuwaayo anaawa nannyonnyola ekyo naye wali ajja abatemeratemeramu ku channel ye olina ne chance emubuuza ebibuuzo najja n'akola ki n'abiddamu. So Doctor, thank you so much.
Pleasure.
Yeah, I'll go get your channel. Share it with people.
Thank you.
Yes.
Thank you very
because
much.
Kati Dr. Ingidde akantu ali mu Kantu fraternity. He has a YouTube channel. Kitegeeza aliko 5 billion.
Hey, but
you're a YouTuber. Yes. You're on the 5 billion.
I need to come and see the president.
I'm the vice president.
Vice president.
Yes, Kasku is the president and he's always here. So now Doctor is on the 5 billion.
On the medical side of
on
the 5
billion. medical side of the 5 billion.
We thank God.
Musibe bulungi mweraba.
Executive Media. Focus, innovate, succeed.